Anatomy and Physiology, the Cardiovascular System, Things You Should Know, Questions and Answers, by Rumi Michael Lee. Introduction. I would like to thank and congratulate you for listening to this book, Anatomy and Physiology, the Cardiovascular System, Things You Should Know, Questions and Answers. This book will help you understand, revise and have a good general knowledge and keywords of the human cardiovascular system. Part 1. 1. What is cardiac revolution? Cardiac revolution is systole and diastole. 2. What is asystole? Asystole is the cessation of the heart contractions. 3. What is differential pressure? Differential pressure is the difference between systolic and diastolic pressure. 4. What is aneurysm? Aneurysm is a protuberance in an arterial wall. 5. What is angiography? Angiography is a radiographic examination of the blood vessels. 6. What are diuretics? Diuretics are substances that increase the production of urine. 7. What is arrhythmia? Arrhythmia is the irregularity of the pulse. 8. What is end systolic volume? End systolic volume is the volume of blood in the left ventricle at the end of systole. 9. What is end diastolic volume? End diastolic volume is the volume of blood that remains after diastole. 10. What is hematocrit? Hematocrit is the rate of erythrocytes. Part 2. 1. What is hemostasis? Hemostasis is blood coagulation. 2. What is anemia? Anemia is the insufficiency of the red blood cells. 3. What is leukopenia? Leukopenia is the deficiency of leukocytes or white blood cells. 4. What is thrombocytopenia? Thrombocytopenia is the insufficiency of thrombocytes. 5. What is hypovolemia? Hypovolemia is the acceleration of the pulse rate caused by bleeding. 6. What is an auscultatory gap? An auscultatory gap is a period of silence. 7. What is the function of neutrophils? Protection by phagocytosis of bacteria. 8. What is the function of the sigmoid valve? The sigmoid valve prevents the blood from returning to the left ventricle. 9. What is the function of the pericardium? The pericardium envelops the heart. 10. What is myocardium? Myocardium is the cardiac muscle tissue. 11. What are the functions of erythropoietin? The production of red blood cells. Part 3. 1. Where is erythropoietin manufactured? Erythropoietin is manufactured in the liver and kidneys. 2. What is the capillary pressure? The capillary pressure is the blood pressure. 3. What is a pulse? A pulse is the wave of the arteries by the contraction of the left ventricle. 4. What is the cardiac output? The cardiac output is the amount of blood ejected at each contraction per minute. 5. What does it mean that the cardiovascular system is a closed circuit? The cardiovascular system is a closed circuit, means that it is a continuous circuit. 6. Name the two blood vessel systems through which the heart pumps blood. The pulmonary circulation and systemic circulation. 7. Give another name for pulmonary circulation. The small circulation. 8. The heart has how many cavities? The heart has 2 cavities. 9. Name the 2 cavities of the heart. the upper cavity, the atria, and the lower cavity, the ventricles. 10. What separates the two cavities of the heart? The atrioventricular valves. Part 4. 1. What is the total duration of the cardiac cycle? The total duration of the cardiac cycle is 0.8 seconds. 2. What are the phases of the cardiac cycle? The phases of the cardiac cycle are the atrial systole 0.1 seconds, ventricular systole 0.3 seconds, and general diastole 0.4 seconds. 3. What irrigates the myocardium? The coronary arteries. 4. Which of the walls of the heart is thicker? The walls of the right ventricle or the left ventricle? The walls of the left ventricle. 5. And why is this wall thicker? This wall is thicker as it does a bigger job. 6. What is the function of capillaries? The capillaries are places of exchange and they connect blood arterioles and venules. 7. The veins have how many layers and name them? The veins have 3 layers, the outer layer, the middle layer, and the inner layer. 8. What prevents blood from flowing back into the veins? The valves in the veins prevent blood from flowing back into the veins. 9. Why is it that the veins can serve as reservoirs? The veins can serve as reservoirs because they are partially filled. 10. What is the function of the veins? The veins send blood to the heart. 11. What promotes venous return? Breathing and activities of the skeletal muscles. Part 5. 1. What is the rhythm and speed of the vein flow? The flow of the vein is regular and rapid. 2. What are the functions of venules? Venules send blood to the heart and ensure the continuity of blood flow. 3. What drains the capillary beds? The veinlet drains the capillary beds. 4. What is the function of the arteries? The arteries take blood away from the heart. 5. What are the layers of the arteries? The inner layer, middle layer, and outer layer. 6. What feeds the capillary bed? The arterioles. 7. What is the adult heart rate standard? The adult heart rate standard is between 60 and 100 bpm. 8. What contributes to the regulation of the heart rate? The autonomic nervous system, adrenaline, and heart rate. 9. The heart has how many valves? The heart rate has 4 valves. 10. Name the valves of the heart. The mitral valve, left, the tricuspid valve, right, the semilunar aortic valve, and the pulmonary valve. 11. Between which ribs is the heart? The heart is between the 2nd and 5th ribs. Part 6. 1. How much liter of blood does the heart send at each contraction? The heart sends 120 milliliters to 140 milliliters of blood at each contraction. 2. What is the weight of the human heart? The weight of the human heart is about 350 grams. 3. Where does the blood go to at every contraction? In the arteries. 4. Pulmonary arteries enter the right atrium by the vena cava. 5. What does the plasma contain? The plasma contains water, urea, albumin, glucose, amino acids, electrolytes, respiratory gases, hormones, etc. 6. What percentage of water does the plasma contain? 90%. 7. What is the lifespan of white blood cells? From 1 to 10 days. 8. How many percent of the blood volume is made up of white blood cells? 1%. 9. What is the lifespan of red blood cells? About 1 month. 10. What percentage of blood volume are the red blood cells? From 40 to 45%. 11. What percentage of blood volume are the thrombocytes? 2%. Part 7. 1. What percentage of oxygen is bound to hemoglobin? About 98.5%. 2. What is oxygen saturation? Oxygen saturation is the 98.5% linked to the hemoglobin. 3. What is the partial pressure of oxygen? The partial pressure of oxygen is the 1.5% of oxygen that remains, either in free form or dissolved form. 4. Oxygen is absorbed into the bloodstream by the alveoli. 5. What is the pH of the blood? The pH of the blood is from 7.35 to 7.45. 6. The blood volume represents how many percent of the body weight? About 8%. 7. The blood is composed of how many percent of plasma? About 55%. 8. What is the resting cardiac output? The resting cardiac output is 5.6 liters per minute. 9. Compare the heart rate of men and women after puberty. After puberty, women have higher heart rates than men. 10. What is tricuspid and bicuspid? Tricuspid and bicuspid are the right and left auriculoventriculares valves. 11. What is the vascular disease that decreases the elasticity of the arteries? The vascular disease that decreases the elasticity of the arteries is atherosclerosis. Part 8. 1. What are the most permeable capillaries? The sinusoids. 2. What is myocarditis? Myocarditis is the inflammation of the myocardium. 3. What is endocarditis? Endocarditis is the inflammation of the endocardium. 4. Where is the blood flow resistance stronger? In arterioles. 5. When is the blood pressure higher? During systole or diastole? During systole. 6. What is the normal rate of hematocrit in a woman? The normal rate of hematocrit in a woman is from 42 to 47%. 7. What is carb hemoglobin? Carb hemoglobin is CO2 linked to hemoglobin. 8. What is edema? Edema is an accumulation of water in the tissue. 9. What part of the heart rests on the diaphragm? The apex of the heart. 10. What are the glands that prolong agitation, effect, and stress? The adrenal glands. 11. Which artery is the largest of in the body? The aorta. Part 9. 1. What is the effect of alcohol on the blood pressure? Alcohol lowers blood pressure. 2. What is the effect of smoking on the blood pressure? Smoking increases blood pressure. 3. The red blood cells A have which antibodies in the plasma? Antigens A. 4. The red blood cells B have which antibodies in the plasma? Anti-A antibody. 5. The red blood cells AB have which antibodies in the plasma? Red blood cells AB do not have antibodies in their plasma. 6. The red blood cells O have which antigens? The red blood cells O do not carry antigens. 7. What determines the regularity of the heartbeat? The sinus node. 8. What is the optimal blood pressure? The optimal blood pressure is 120 mm of mercury of systolic pressure and 80 mm of mercury of diastolic pressure. 9. What is the normal blood pressure? The normal blood pressure is 120 to 129 mm of mercury of systolic pressure and 80 to 89 mm of mercury of diastolic pressure. 10. Name the main blood components. The main blood components are the plasma, red blood cells, white blood cells, and platelets. Part 10. 1. What are the arteries that feed the upper limbs? The axillaries. 2. What are the arteries that feed the lower limbs? The femoral. 3. What do neutrophils do? Neutrophils phagocytize bacteria. 4. What is the role of the heart? The role of the heart is to pump blood. 5. Name the stages of coagulation. The stages of coagulation are fibrinogen, fibrin, and clot. 6. What is the volume of the human blood? The volume of the human blood is from 5 to 6 liters. 7. The first sound of the heart corresponds to? The closure of atrioventricular valves. 8. Do the walls of the arteries have valves? No, the walls of the arteries do not have valves. 9. Which blood vessels connect the arteries and veins? The capillaries. 10. What is the yellow liquid of the blood? The yellow liquid of the blood is plasma. 11. What is atrial systole? Atrial systole is the contraction of the atria. Part 11. 1. What is the mediastinum? The mediastinum is the place where the heart is situated. 2. Does the large circulation feed the lungs? No, the large circulation does not feed the lungs. 3. Does the left side of the heart and the right side beat at the same speed? Yes, the left side of the heart and the right side beat at the same speed. 4. What is ECG? ECG is electrocardiogram. This serves to see the electrical activity of the heart. In ECG, what does this correspond? 5. The P wave? The P wave is the contraction of the atria or atrial systole. 6. The PQ segment. The PQ segment represents the time required for the transmission of the electrical pulse from the node SA, sinus node, to the AV node, atrioventricular node. 7. The QRS complex. The QRS complex represents the ventricular depolarization and triggering of the AV node. 8. The Q wave. The Q wave corresponds to the depolarization of the interventricular septum. 9. The R wave. The R wave corresponds to the depolarization of the main mass of the ventricles. 10. The S wave. The S wave represents atrial repolarization. 11. The ST segment. The ST segment represents the potential for myocardial action. 12. The T wave. The T wave represents ventricular repolarization. Part 12. 1. What factors favor the resistance of blood vessels? The length of the vessels, the diameter of the vessels, and the viscosity of the blood. 2. What influences the number of white blood cells? Infections. 3. What are the 3 layers of the heart wall? The 3 layers of the heart wall are the epicardium, myocardium, and endocardium. 4. Do platelets come from the red bone marrow? Yes, platelets come from the red bone marrow. 5. What is blood pressure? Blood pressure is the force exerted on the blood vessels. 6. What is the function of leukocytes? Protection against foreign agents. 7. What is hemophilia? Hemophilia is a lack of normal blood coagulation. 8. What is the cause of hemophilia? Hemophilia is caused by genetic abnormality. 9. What is hematoma? Hematoma is an accumulation in the tissues of coagulated blood. 10. What is septicemia? Septicemia is an infection of the blood by bacteria. 11. What is hematology? Hematology is a specialty in medicine that studies blood. Part 13. 1. What is the function of the serous fluid? The serous fluid is a lubricant. 2. Elastic arteries are also called conductive arteries. 3. The muscular arteries are also called distributing arteries. 4. Which hormones increase blood pressure? Adrenaline, noradrenaline, etc. 5. Which hormones decrease blood pressure? The atrial natriuretic factor. 6. What is a heart murmur? A heart murmur is an anomaly of the valve. 7. What is the pacemaker of the heart? The sinus node is the pacemaker of the heart. 8. What are cardiovascular diseases? Cardiovascular diseases are diseases of the heart and blood vessels. 9. What is hypertension? Hypertension is a very high blood pressure. 10. What is angina pectoris? Angina pectoris means that a part of the heart is not receiving enough oxygen. Part 14. 1. How do white blood cells move? White blood cells move by diapetesis. 2. Where is fibrinogen found? Fibrinogen is found in the plasma. 3. Do the arteries have thick or smooth walls? Arteries have thick walls. 4. What is ventricular diastole? Ventricular diastole means that the ventricles are at rest. 5. What is the minimum pressure? The minimum pressure is the diastolic pressure. Conclusion. Thank you once again for listening to this book. I hope it has helped you in your journey to understanding the cardiovascular system of the human body.